Yep.
Come in.
Hi, I'm Nurse Kathleen.
Hi, I'm Kaylee.
Hi, nice to meet you.
Nice to meet you as well.
So what brings you in here today?
I hit my head playing soccer yesterday, and I have a headache.
Oh, okay. So we're going to do a neurological assessment.
Okay.
So we're going to test your cranial nerves. We're
Okay.
going to start with cranial nerve number 1, which is your olfactory nerve. To test this, I'm going to have you close your eyes.
Okay.
Well, you don't have to do that right now, and then she's going to close one nostril at a time, and I'm going to have you smell something, and you have to tell me what you're smelling.
Okay.
Okay? So close your eyes.
Okay.
Can you cover your left nostril?
Sure.
Okay. Can you tell me what you're smelling?
Coffee.
Perfect. Okay. Now cover your right nostril, and can you tell me what you're smelling?
Soap.
Perfect. Okay. So her olfactory nerve is in check. Next, we're going to do cranial nerve number 2, which is her optic nerve. Okay, I'm going to have her do the smell and eye test. We don't have the chart with us. If we were in a doctor's office, there would be a smell and eye test in the chart, and I'd have her stand 20 feet away and test her 20/20 vision. We don't have that with us, so we're going to use the pocket version. I'm going to have her close one eye and tell her to if she can read what it says. So can you hold this and tell me what you read on that line?
Sure. It says QRSNOP.
Perfect. Okay, and can you test the other eye for me too?
Sure. Same line?
Mm-hmm.
QRNSOP.
Perfect. Okay, so her optic nerve is in check. Next, we're going to do cranial nerves 3, 4, and 6, which are ocular motor, trochlear, and abducens. Okay, to test these ones, I'm going to do direct and consensual. Okay. So can you just move your chair up a little bit? Okay. So when testing direct and consensual, I'm going to have her open her eyes. I'm actually going to shut the blinds, so make it a little darker in here. And I'm going to come in from the side with my pen light to see, and this is consensual, to see if I shine it on this pupil, if the other pupil does the same thing. Both of the pupils should do the same thing at the same time. Okay, so I'm going to come in from the side. Okay, perfect. When I did that, both of her pupils constricted. As the left one constricted, the right one did the same. That was consensual. Now I'm going to come in directly. Can I have you just stare right at the wall back there? Perfect. And I'm going to come in about 12 inches away, okay, and shine the pen light in the center at her midline of her face, and both of the pupils should constrict at the same time. Perfect. They both constricted at the same time. Okay, to continue, I'm going to do confrontation. This is continuing on cranial nerves 3, 4, and 6. Can you stand up? Confrontation tests her peripheral vision. Okay, so can you tell me when you see my wiggling fingers? And, oh, sorry, can you close your right eye for me? And with your hand? Perfect. Now, can you tell me when you see my wiggling fingers, okay?
See them. I see them. I see them.
Perfect. Okay. So that tested her peripheral vision, and we're going to do it the same for the other eye. So can you cover your left eye now?
Mm-hmm.
Perfect. And tell me when you see my wiggling fingers.
I see them. I see them. I see them.
Perfect. Okay. So she has perfect peripheral vision. Next, I'm going to test her cardinal positions. So, Katie, I'm going to ask you to keep your head still and move only your eyes as you follow my finger, okay?
Mm-hmm.
So just move your eyes and keep your head still.
Okay.
Ready?
Mm-hmm.
Perfect. Okay, those were the cardinal positions. So now I'm going to do, you can sit back down. I'm going to test cranial nerve number 5, which is her trigeminal nerve. Okay, so I'm going to put my hands on her face right here and ask her to grind her teeth. Can you grind your teeth? Perfect, perfect. Okay, and then I'm going to ask you to close your eyes and tell me if you feel this.
I feel that. I feel it. I feel it. I feel it.
Perfect. Okay. Now I'm going to test cranial nerve number 7, which is her facial nerve. I'm going to ask you to smile for me. Can you frown? And can you raise your eyebrows? When she smiles, frowned, and raised her eyebrows, each moved symmetrically. So, which is good. Now I'm going to, oh, and can you also puff your cheeks for me? Okay, that was perfect, because both of her cheeks deflated at the exact same time when I puffed them out. Okay, next I'm going to test your acoustic nerve, which is cranial nerve number 8. Okay, I am going to do the whisper test, the Rhine test, and the Weber test. I'm going to start with the whisper test. Okay, Kaylee, can you can you cover your right ear for me, please? And tell me what word I'm saying after I say it. Ready? Christmas.
Christmas.
Okay, can you cover your left ear for me? Baseball.
Baseball.
Perfect. Okay, next I'm going to do the Weber test. When doing the Weber test, I'm going to put the tuning fork on top of her head, and Kaylee should be able to hear equally out of each ear. So let's test it. Can you hear out of both ears?
I can.
Is it equal?
It's a little stronger in my right.
Okay, so it's a little stronger on her right side, so that might be that she hears better out of her right ear, or simply that she may be congested, and which is blocking the hearing out of her left ear, something like that. Okay, next I'm going to do the Rhine test, which tests bone and air conduction. I'm going to put the tuning fork right here, and I'm going to ask her to tell me when she can no longer hear it, which tests bone conduction, and then I'm going to move it right here and tell me when she no longer hears it. The air conduction should be twice as long as the bone conduction. I'm going to use the clock on the wall right in front of me to test and see the time. Ready?
Mm-hmm. I can't hear anyone. I can't hear anymore.
Perfect. When timing it, I noticed that her bone conduction was half of what her air conduction was. Okay, next up, test cranial nerves 9 and 10, which are your glossopharyngeal and your vagus nerves. So I'm going to test your gag reflex first.
Okay.
When doing this, I test your gag reflex. So I'm going to ask you to open your mouth. Okay. I noticed that the tongue is on the midline of her body. Okay. And I'm going to have you say ah.
Ah.
When she said ah, her uvula moved up and down. So now I'm going to move my tongue depressor to the side of her tongue, and she should have a gag reflex. Perfect. She showed a gag reflex. Now I'm going to test cranial nerve number 11, which is her spinal accessory nerve. So to do this, I'm going to press down on her shoulders and have her push up against resistance. Perfect. And now can you turn your head to the left? Okay, and can you turn your head to the right? Perfect. She was able to move her muscles against resistance, which is what I was testing for in this spinal accessory nerve, cranial nerve number 11. And lastly, cranial nerve number 12 is the hypoglossal nerve. So can you say light, tight, and dynamite for me?
Light, tight, dynamite.
Perfect. And that tested her hypoglossal nerve, cranial nerve number 12. So now I'm going to test her cerebral function. First, I'm going to have her do the tandem walk. Okay. Can you start right in front of your chair and walk heel to toe towards me? Perfect. Okay, she was able to successfully walk heel to toe. Okay, now I'm going to do the Romberg test to continue testing cerebral function. So can you stand, when doing the Romberg test, she has to stand with her eyes closed for approximately 20 seconds. When doing this test, I'm going to stand directly in front of her, so that way if she were to fall side to the side, I'd be able to catch her. Each side, I'd be able to catch her if she was falling backwards or if she was falling forwards. Okay? So can you close your eyes for me, Kaylee? Notice as she's closing her eyes, she's not swaying to side, she's not falling forward, and she's not having trouble with her balance. So, which shows that she is in good cerebral function. Okay, you can open your eyes for me. Okay, now I'm going to test the RAM, which is the rapid movement. Okay, so can you touch your thumb to each of your fingers rapidly for me? Perfect. Okay. So next I'm going to test her kinesthesia. I'm going to have you close your eyes, and can you take your index finger and hold it straight out and point it at me perfectly. Now can you move it up? Oh, keep your hand still and move only your index finger for me. Can you move it up, down, and then put it straight again? And now can you move it to the left and to the right? Perfect. Okay, and now I'm going to test her stereogenesis. I am going to have you be able to detect an object that I put in your hand. Can you put your hand out for me and close your eyes? What did I place in your hand?
A spoon.
Perfect. Okay, now I'm going to test her graphesthesia. When doing this, I am going to have her hold her hand out, and I'm going to have her close her eyes, and I'm going to write a number on her hand. She should be able to detect what number I'm writing. Ready?
Yes. 8.
Perfect. I drew a number 8 on her hand. Okay, and lastly, I'm going to test your reflexes. Can you hop up on the bed for me?
Sure.
Thanks. Okay, the first reflex I'm going to do is her quadriceps reflex. Okay, can you just sit back a little bit more for me?
Mm-hmm.
Perfect. When testing a quadriceps reflex, you want to make sure the patient is relaxed. And if they're having trouble relaxing, what you can have them do is cross their arms and tell them to pull tightly on their elbows so they're concentrating on something other than their legs. Okay? So what we'll do is try it first, and if she's unable to show a reflex, then we'll have her concentrate on something else. But she seems healthy where she would show a reflex. The quadriceps reflex is located right between the two bones, right in her knee. So I'm going to take the flat side of the reflex hammer and test it. Perfect. Okay, so she showed a reflex as I did it again, and I'm going to test the other knee. Perfect. So she has perfect reflexes in each of her knees. And lastly, what I'm going to test is her Babinski reflex. I'm going to just take off her shoe, and what I'm going to do is I'm going to, on the bottom of her foot, draw a C. Okay? When she does this, her toes should either not show any change at all, or they should curl inwards. They should not fan out. If they fan out, that shows a neurological problem. So I'm going to start on her heel and draw a C. Okay, her toes curled, which shows, she's kind of ticklish, and that that was fine because her toes didn't fan. And now I'm just going to test the other heel, or the other foot as well. Perfect. Okay, Kaylee, that was the end of your neurological exam. I'm sorry to hear about your headache, and the doctor will be in a moment to diagnose you.
Thank you.
Okay, it was great meeting you.
You too as well.
Okay, have a great day.